practice to not be an early adopter of technology. And the reason is because I like to see that things work before I offer them to patients. And there's an awful lot in cosmetic medicine and aesthetic medicine that is really gimmicky. And in my career, I've seen things become very popular only to be discovered not to work very well, to lose favor among the public, and or to cause harm in many cases. So I like to see that things work really well before I bring them on, and I consider myself a no gimmick practice, and I think it's one of the things that I'm talking about is radiofrequency microneedling and all therapy.
Yeah.
Because they're marketed as a replacement for facelift surgery.
Right.
And I think this is a crazy notion. I think it's not honest sales, really.
No, it's asking a lot of a device to give you that type of result.
Yeah.
And patients ask me all the time about, what non-invasive skin tightening, like treatments you can do. And I just tell them to be careful because it's kind of like they want all this result with absolutely no downtime. And so I tell them to be leery of, spending a lot of money on these devices. Right. And the expectation is that they're going to get facelift type results. Right. And then they get through their treatment, they spend all this money, and then the result is not, tangible.
Right. So I love that you, in the practice that you came from, have a lot of experience with this device, and now we're sort of came on and confirmed my suspicions that they're not the greatest. They're not the answer to these problems. So what is your experience with these devices?
So I would say that the results were not reproducible in a consistent way. So some people had a little bit of result, and some people before and afters, it was not anything that you would like. It was not a jump up hooray type result. So that's hard as the provider, because you want to offer something, you want a result at the end of it. Your patient's investing into their anti-aging and their looks, and so.
Well, you told me once you felt that you were apologizing more than you were.
And I had to apologize a couple times after the full series, just like the recommended treatment plan. And so it is discouraging when, and some patients got, a little bit of skin tightening, but I would say it was definitely, in my experience with using these devices, not a replacement for a facelift.
So what these devices do, the radiofrequency microneedling and the all therapy, is that they deliver energy at variable depths into the skin. The energy heats the tissue and evaporates water, and it causes the shrinkage of the tissue and production of collagen. And those things are real, but there's only really so much that you can do with that. And there's probably a subset of people who are decent candidates for that, like people who are in their 30s or early 40s who are trying to prevent things. The problem with that is that you're essentially cooking your skin. And if you think about a piece of chicken, for example, when you apply heat to it, before you cook it, it's mushy, and if you imagine it sagging, being equivalent to your skin, once you heat it, it denatures the protein and it makes it firmer. That's what you're essentially doing to your skin. You're cooking it, and it's making it firmer, and it's not going to take a large degree of sag and make it go away. No. It will maybe, in somebody who has a very minor problem, make it a little bit better. But from the standpoint of the surgeon, who then goes in 5 to 10 years later, when the sagging has recurred, you have forever changed the nature of your skin. First of all, it's no longer as elastic as it would have been if you hadn't done that treatment. you've changed the microvasculature of the skin, so it makes the risk of complications like wound healing problems at the incision line a lot more common. So I really hate when I see people who come in who have had all therapy or radiofrequency microneedling, because I know that it's going to be a much tougher facelift, and it's going to be more risky with complications, and I'm not going to get the same redraping of the skin. It's like doing it on a smoker or somebody who's had radiation or any of those things that really denature the tissue and make it not normal anymore. So if I were in my 30s and had the option of preventing aging with all therapy or radiofrequency microneedling, I would not do it. I would wait for the problem to get bad enough that I needed a facelift, which is what I did. I had a facelift in August. I'm glad that I waited because I got a great result and it was uncomplicated and all of those things. The other thing is that I have had patients come to me who have had these treatments, all therapy specifically, where the treatment, which is you can't control the depth very well in everybody because everybody's skin thickness is different, it got down below the skin and it melted their fat. And it made the fat contour in their cheeks and along their jawline not normal, and they ended up coming to me for fat grafting, which is, imperfect. And so it's just like
you're creating more of a problem. Like, it seems non-invasive at the time. It seems like an easy answer. But it comes with risks, and one of those, and if you're going to someone who doesn't know the anatomy of the face, which, who knows, these radiofrequency microneedling devices and all therapy, they're everywhere, and so
they're sold to non-surgeons.
Exactly.
Which is, to me, the craziest.
As people who pop the hood and are looking at the anatomy of the face in surgery, it makes you take a step back and say, okay, well, this is you can very easily melt the fat. And then you're accelerating aging at that point. And so
your margins are too thin with that. There's too much.
It's unpredictable.
It's unpredictable.
Because then, as we age, our dermal thickness gets thinner, and so you can't treat every person the same. The margins are, you can easily make a mistake with that. And create a problem.
Well, they're created to go down below the level of the skin, actually. So they're created to deliver that energy in many cases to like 4 millimeters depth is right into the fat layer. Anything less than that is not going to really give the same result either. So I'm not sure where the promises come. But the biggest thing is that if you're never going to have a facelift, then maybe like that group of people, you use it as a prevention tool. You'll get some, because I've certainly heard of people getting good results with these devices. It's just so much of a risk to me. And put in the hands of these med spas that are run by,
you really don't know
who knows who. Then I guess that comes back to the bottom line of when you're choosing the med spa, make sure that that's headed up by a plastic surgeon, a facial plastic surgeon, a board certified dermatologist, somebody who is really got stake in the game. Not, there's a lot of venture capital people opening up these med spas that have, who knows at the helm.
Do your research.
Do your research.
And